Friends, today we will discuss how to approach chest X-ray in part 3. In total, for examination of X-ray, there are 3 sections present. You have to follow 3 sections. I have already discussed first 2 sections, that is history and RIP. History contains whose, where, when and why. Second section RIP contains rotation, inspiration and penetration. I have already discussed about history and RIF. Today we will discuss about third section, that is A, B, C, D and E. A for examination of airway, B for examination of breathing, C for examination of circulation, that is heart, D for examination of diaphragm and delegates. Delegates means which is breakable, that is bone. Lastly, we have to discuss examination of extras. Let's discuss examination of airway. Examination of airway includes examination of pharynx, larynx, trachea and carina, bronchus and bronchioles. Again I am telling, it includes pharynx, larynx, trachea and carina, bronchus and bronchioles. As air present inside airway, on X-ray it appears black in color. Remember their anatomical positions or where they are located. Let's discuss tracheal position and its color. Normally trachea black on X-ray as air inside. Normally trachea is situated at center, that is at midline. In the other word, it is on and parallel to vertebral column. Again I am telling, normally trachea looks black on X-ray as air inside. It is situated at the center, that is midline. In the other word, you can say it is on and parallel to vertebral column. If trachea not situated in center or midline, that means it is a deviated trachea. It may be deviated to right or to left side. That means it is away from spine. Again I am telling, deviated trachea means away from spine. That is, it is not in center or midline. It may be deviated to right or it may be deviated to left side. When you are getting a deviated trachea on X-ray, you should find its cause. It may be due to push effect or due to pull effect. Push effect means trachea is pushed to other side by a mass in contralateral side. That means tracheal position and the mass both are in different side. Pull effect means trachea is pulled to the pathological side where the mass is present. That means tracheal position and the pathological lesion both are on same side. Locate the position of trachea on chest X-ray. It is situated at midline, that is at center, which is marked by a circle. That means it is situated on and parallel to vertebral column. It appears black on X-ray as air inside. Again see the position of trachea on chest X-ray. It is situated at midline, that is at center and on and parallel to vertebral column. It appears black due to air inside. Locate the tracheal position, right bronchus, left bronchus and carina where it is divided. Look also the position of spinous process on which or over which trachea is situated. Trachea is generally situated at midline, at center, on and parallel to vertebral column. See the position of aortic knuckle and other bony impressions. See the position of spinous process over which trachea is situated. See the tracheal position, right bronchus, left bronchus and carina where trachea is divided. After locating trachea on chest X-ray, you should inquire about whether it is at center or deviated. If it is at center, that means it is at normal position. If it is deviated to right side or left side, that is away from spine, that means it is at abnormal position. In presence of deviated trachea, you should look for its cause, whether it is due to pull effect or it is due to push effect. After getting a tracheal deviation on X-ray, you should search what is its cause. It may be due to pull effect or due to push effect. Push effect means trachea is pushed to other side by a mass in contralateral side. That means pathological lesion and tracheal position are in different side, not in same side, which is due to mass effect. One of the example is tumor, pneumothorax and pleural effusion. Pneumothorax push the trachea more to the other side in comparison to pleural effusion. Again I am telling, push effect due to tumor mass, pneumothorax and pleural effusion. Pull effect means trachea is pulled to the same side where pathological lesion present. In this case, both the tracheal position and pathological lesion are in same side. Pull effect is seen in case of atelectasis or collapsed lung. Remember, push effect is due to tumor mass, pleural effusion, pneumothorax. Pull effect is due to atelectasis or collapsed lung. On comparison, pneumothorax pushes the trachea to other side more than pleural effusion. In the slide, trachea is in center or midline. In the other word, trachea is on and parallel to vertebral column. In case of deviation, it may be due to pull effect or due to push effect. In this case, trachea is pushed to the right side by a mass in contralateral side. In this case, tracheal position and the pathological lesion both are in different side. Whole the thing is due to push effect. In this case, trachea is pulled to the right side and pathological lesion are also in right side. That means tracheal position and pathological lesion both are in same side. Whole thing is due to pull effect, which is due to collapsed lung or atelectasis. In this case, trachea is pushed to the right side by a mass effect. That is, it may be a pleural effusion or tumor in left side. Whole thing is due to push effect. By doing next investigation, that is CT scan of thorax, it was found that there is a mass present in left side of thorax, which is the main culprit for tracheal deviation to right side. In this case, trachea is pushed to the right side by pleural effusion on left side. In this case, whole thing is due to push effect. Now discuss about how to examine carina. Carina is the level where trachea divides into two bronchus. Normal carinal angle is in between 40 to 80 degree. Any deviation of its angle suggests mass effect or tumor present. So always search for the carina angle is wider or not. Right bronchus is short and more vertical, and also it is direct continuation of trachea. That's why right lung or right lower lobe is more prone for aspiration pneumonia. And also it is very easy to entry into the right bronchus during intubation, where it is called as a bronchial intubation. But normally during intubation you should keep the tube 2 finger breadth above the carina. Left bronchus is long, more obtuse and a small branch from trachea. Again I am telling normal carinal angle is in between 40 to 80 degree. Always search whether carinal angle is wider or not. Any deviation of its angle, that is 40 to 80 degree, that means it is due to mass effect or tumor present. Right bronchus is short and more vertical. Left bronchus is long and more obtuse. See the intrathoracic view of trachea and two bronchus, where right bronchus is short and more vertical and left bronchus is long and more obtuse. Thank you. Thanks for watching.